Well, it works on a very informal way, which makes it different from making an appointment, from a nurse being in a clinic expecting, having a list of people who are coming by arrangements. The people who come to the coffee morning are also in a different mode. They've come for a coffee and chat with their friends, and they go and see a nurse. So the whole expectation on both sides is completely different. So it's very informal, very impromptu, and what the nurses have been very sensitive about is actually not wearing a uniform, coming out into the coffee morning, sitting quietly next to people, talking to them and getting to know them a bit before starting the consultation. A lot of the people who come here are saying things like, well, I'm so glad I've spoken to the nurse because I wouldn't have wanted to trouble a doctor. There's
the feedback you're getting from people who've used it?
Very reassured, feel listened to and feel that they can get the help that they need without feeling a burden or a nuisance to anybody. So I think that's very important.
What do you think the community nurses themselves have gained from it?
I hope they have realised, I always think when you're working in a health setting, you're actually working in an illness setting, and it's very easy to focus on the illness and not see how people with these disabilities and illnesses actually live and function with that. And I think that it's a good model to keep in your head that yes, there are all these chronic conditions, but actually the people are managing, they're getting out and they're taking part in community events despite it.
They're extremely good, the ones that we've got, I must admit. And they take time to talk to people, they're doing the job as they are, people love them.
Yeah, everyone's been saying the nurses are all really lovely and all really helpful, and there's a lot of people saying it's reassuring. The users have said that the nurses have time, like because the GP has so many people to see, but the nurses can see each person individually and assess their needs and do what needs to do what needs to be done, and refer them on to who they need to be referred on to. Mm-hmm. And it's just the fact, I think, that the nurses have got a lot of time for everyone and they walk around and get to know everyone individually.
So what's your impression of Chorlton Good Neighbours, having come to it from...
I love it. I think it's great. I think every place should have it.
Would you encourage other students to try something like this?
Definitely. It's helped me to be able to approach people and talk to people, especially from different generations, and I've just learned so much from people.
Well, it seems very popular. A lot of people seem to be wanting to go and see the nurse and talk to them, and seem quite happy that they've been. And I think it's quite useful for people who are slipping through the net, because then they can meet the nurses informally when they're having a coffee and just have a chat with them and then see, is this person getting the help they need, if you see. A lot of people say, I don't want to bother the doctor. His time's too precious. And so they don't want to go unless it's something serious. And so a little thing, they might wait till they've got 2 or 3 little things building up before they go. Whereas in fact, it could be something very important like skin cancer, which if it's seen, it gets acted on quicker. The hearing aid lady comes once a month, and that is really popular, and she gets lots of people coming, and they've got that in their diary that the first Thursday of every month she's here. So I think in the same way, if they knew the nurse was here, they would use it, yes. No, but I just think the more we can all work together, all the services can work together, the better service it's going to produce for people.
And actually having it where people are rather than expecting people to come to it, is it?
Because some of our people, it's transport. They get a lift here, and it might be the only time they get out in a week. So for them to get a taxi to go down to the doctor is difficult, and they don't want to call the doctor out unless it's serious.
I went in by chance because I got a sore toe, and they're absolutely brilliant. They said you need antibiotics. They got in touch with the surgery, they got all my medication, they talked to them and everything, and got a prescription. But I am very impressed. I think it's excellent, and we're so lucky to have it here.
Yeah, we
really are.
Yeah.
Well, I think it's a good thing that they're here, because sometimes you have things you would like to ask your GP, But sometimes when you get there, what you plan to ask them, you don't get to ask them. For some reason, maybe you get a bit frightened or whatever. But anyhow, when you have the nurses that come in our Chorlton Good Neighbours, I think it's a good time to speak to them one-to-one, because I think it's very interesting, because like me as a diabetic, have the nurses here to talk to and to have a chat with them and explain things to them, and they explain things back to me. It widened my understanding, and I very much appreciate them coming, and I hope they continue to come to help us.